Yeah, thank you very much.
Thank you.
Yeah, thank you. Thank you. Thanks for the opportunity to speak on post-operative care. Yeah, you can start now.
Hello, everyone. A very good evening to all of you. Myself, Dr. Jamuna, heading Clinical Operations and Business Development at QurHealth. I welcome you all for today's webinar session on post-operative care. We will discuss on how these services enhance patient recovery after surgery. Our guest speaker for today is Dr. Parameshwar, a renowned surgeon in Bangalore. Firstly, for those who do not know about our company, QurHealth, I would like to give a brief introduction. QurHealth is a conversational AI company delivering personalized care at scale. At QurHealth, our vision is to save lives super proactively. Our mission is to improve patient quality of care, patient safety, patient care adherence, and patient awareness. Our user-friendly app, Qurbook, has more than 2,500 care plans and diet plans under 30 different health categories. These plans will help to improve patients' health condition by monitoring vitals, symptoms, and everyday lifestyle management activities which are specific to disease condition. Our post-operative care concierge program consists of expert care team with specialist doctors, dietitians, physiotherapists, counselors, and highly skilled nurses as care coordinators. These nurses will remotely monitor patients' health condition through regular follow-up calls and make sure patients adhere to the care plan activities, take medication on time, and address to patients' concerns immediately. They act like a bridge between the doctors and the patients. Diet consultations are provided by our expert dietitians with customized diet plans to every patient. Wound care counseling, diabetes counseling, fitness or physiotherapy counseling, psychotherapy counseling sessions are provided by our expert care team. In a span of 3 months, we have served more than 300 post-operative care patients and have received positive testimonials and feedbacks from most of these patients. Before we start today's webinar, I would like to introduce our guest speaker, Dr. Parameshwara C.M. Dr. Parameshwar is a chief colorectal specialist and an expert surgeon. He is the CEO and founder of Smiles Gastroenterology Hospital at Bangalore. He did his MBBS and MS from Bangalore Medical College and later did diploma and fellowship programs in coloproctology. With more than 20 plus years of experience and training in the field, he is one of the best colorectal specialists in India. In Karnataka state, he is the first surgeon to start laser treatment for colorectal or digestive disorders, STAR procedure, video-assisted anal fistula treatment, and MRI difficography. He is honored with National Award for the Best Awareness Campaign on Colorectal Problems in 2020 and is the first surgeon to start an exclusive colorectal center in Karnataka region. Welcome, Dr. Parameshwar, and it is a great honor for us to have you today as our esteemed speaker for the webinar session.
Thank you, Jamuna. Thank you so much. Yeah.
I would like to inform all the viewers that you can type your questions in the comment section, and these questions will be answered at the end of the webinar during the Q&A session, which will be conducted by Dr. Isha. So let's begin our webinar session on post-operative care.
Yeah.
In the world of modern medicine, surgery stands as a cornerstone, addressing diverse medical conditions and improving the quality of life. However, the success of any surgical procedure goes beyond the operating room. The post-operative care phase plays a vital role in ensuring the patient's smooth recovery and ultimate well-being. Recovery after an invasive surgery is vital in making the treatment successful, and this phase can be slow, stressful, and worrisome many times. Research has showed that 7 to 15% of patients who are undergoing major kind of surgeries will experience post-operative complications. And each year, around 4.2 million people around the world die within 30 days of surgery. And post-operative deaths account for 7.7% of all the deaths. Gastrointestinal surgeries are among the most performed surgical procedures worldwide, and proper post-operative care significantly impacts patient outcomes and also reduces the risk of complications. After every surgery, adhering to doctors' specific instructions is very, very important. And in preventing the complications such as infections, supporting the healing of surgical incisions, and ultimately restoring the patient to a state of perfect health. Hence, today's webinar emphasizes the significance of adhering to the post-operative care protocol and how it contributes to successful recovery and improves overall well-being of the patient. So, Dr. Parameshwar, in your journey as an expert surgeon, you would have performed thousands of surgeries. Please let our audience know the importance of gastrosurgeries, types of complications post-surgery, and how these can be prevented and managed.
Yeah, you were asking me to specifically talk about the GI surgeries, gastrointestinal surgeries. Okay. Before that, you were telling about the statistics, the numbers. 4.2 million people around the world die within 30 days surgery.
Yes.
Scary.
Yes.
One should not die. Forget about 4.2 million people. It's big number. Even one should not die. Okay. So these numbers are coming from surgeries across specialties.
Yes.
Across specialties. Okay. Sure, you were stressing post-operative care only in GI surgeries here. Okay.
Yeah.
So, as a surgeon first, for me, a surgery, I would make a statement: surgery happens in the hospital. Clear? Surgery happens in the hospital, and the healing happens at home. Right?
Yeah.
So healing happens at home, and I remember when there was no technology, when there were no mobile phones. We were all graduating during the era where we didn't have any mobile phones, where we didn't have connectivity, right? So while doing post-graduation, we used to operate and keep patients. For a small pile surgery, we used to keep patients for about 15 days in the hospital. Why? Because we didn't have proper people to manage at home. We didn't have communication systems at home. And one patient would occupy 15 days of hospital bed. On those days, beds were in shortage.
Yeah.
Imagine people occupying hospital beds for just post-operative care, and there's no proper care at home. So from that era of 90s, where we were graduating and doing post-graduation, to today's era of AI, managing healthcare, there's a huge transformation, especially in the digital space. So here I come from a context where post-operative care can be given utmost importance after the surgery in the hospital and reduce deaths, reduce morbidity and mortality due to operations. Okay, so now any surgery requires a post-operative care. Post-operative care happens at home. Surgery happens in the hospital. Correct? So with the technology, with communication happening, so lots can be done to post-operative care at home without causing morbidity and mortality. And our experience also says in the last, we've been working with few post-operative care companies. Our experience also says that with post-operative care, our feedback is good from the patients. The word of mouth referral, which is strong for any healthcare organization, has become strong for us because of very good post-operative care. Our NPS score is high because of post-operative care.
True, doctor. Yeah. Yeah. Thank you so much for that insights, doctor. And yeah, So let our audience know about these general gastrosurgeries that you have been performing on a regular basis, and what are the kind of complications usually happen, and how is that they can manage it?
Yeah. See, we started as a colorectal institute. Now we have moved to gastro institute, right? We started as colorectal. In the last 5 years, we have really, had good traction in the field of complete gastrosurgeries. Now we operate from mouth to anus anywhere, but majority of our work is colorectal. That is piles, fissure, fistulas, perineal abscess, pulmonary sinus, colonic polyps, colon cancers, rectal cancers, and anal cancers. Right? So imagine a person undergoing a colorectal surgery, any surgery in the anus, any surgery in the rectum, we've operated. Clear? And that region, you cannot cover it. You cannot bandage it. Right? We need to move the bowel every day. When the bowel passes, there is a raw area. It will cross across a raw area. There is friction. There is pain. There is burning. There is irritation. You got it? So you can get a cardiac surgery where there is a keyhole cardiac surgery, or you open the sternum, open the heart, and do a surgery. There is a dressing here. There's a bandage here, and there's no pain at all. You get away with painkillers. But here, you need to move the bowel every day. So when the bowel moves every day, you are prone for infections. Patient is prone for infections, and there is very, very bad pain. Pain management is very, very important here. So in our kind of surgeries, what is more important is the medications, number one. Number two, the pain management. Number three, keeping the area clean, neat.
Yeah.
Number four, a very good diet. Number five, getting back to work as early as possible. Number six, getting back to physical activity within 24 hours of the procedure. So all these things are possible only when we have a good post-operative care platform. Clear? So these are what we expect in a patient. Coming to the complications in colorectal surgeries, the most dreaded complication is when we operate on a pike surgery, we do a DGR procedure, Doppler guided hemorrhoidal artery ligation with a laser hemorrhoidoplasty. By chance, if the artery slips, there is a heavy torrential bleed which needs immediate attention, And not all people are same. Different people behave differently to pain. The maximum number of anoderms in the body or in the anal canal. The next thing is the pain. Imagine I am a doctor and I'm a surgeon. Started my day at 6:30 in the morning. Now I'm winding up. After this, and patients start calling, everybody is accessible now. There is a telephone. If you don't pick the call, the patient will tell, doctor, I called you. You're not picking my call. You operated on me. It is your duty. It is your responsibility.
Yeah.
Operating about 200 surgeries a month. If I start taking every call, I'll become a telephone operator.
Yeah.
Okay, so that is the reason we have this post-operative care platform from QurHealth, right? So every single question by the patient related to medicine, related to diet, related to physiotherapy, related to sex path, related to their physical mobility, related to getting back to work is answered in QurHealth. It makes life easier for the patient, life easier for the doctor also. Anything which cannot be handled by QurHealth will be escalated to the primary consultant who operates the patient. There's always 24 hours when we are there, but still, we also need at least 6 hours of sleep, 2 hours of, to spend time with the family, right, in 24 hours. So these are the things which requires utmost care. Complications, one I said is bleed, second I said is pain. The third is infections, anal canal, passing stools every day, not keeping the wound clean and dry, may lead to very severe complications, sepsis, and we have seen many mortalities arising out of anorectal surgery and patients going to the ICU and losing life. This is one of the very bad complications, sepsis. So these are the three things which I see as very important complications in a anorectal surgery when we operate on piles, fissure, and fistula or a pulmonary sinus.
Yes, doctor. Thank you. Thank you for that elaborate introduction on the types of gastrosurgeries. So worldwide, the overall prevalence of hemorrhoids in the general population is estimated to be around 4.4%. Is the rising trend of these hemorrhoids related to the lifestyle choices and food habits? Could you please explain to our audience the factors that contribute to the development of hemorrhoids?
Yeah, see, constipation is the mother of all anorectal problems. Constipation, right? It may be hemorrhoids, it may be fissures, it may be perineal abscess, it may be fistulas. Constipation is the mother of all anorectal problems. Constipation can be of medical constipation and surgical constipation and lifestyle related constipation. Generally, what people think is if they pass a hard stool, they think it is constipation. Actually, it is not. It is just an episode of hard stool. Okay, so whenever people take less water, less fiber, less vegetables, less sleep, less physical activity, sitting in a place for a long time, spending in the washroom more than 30 minutes, they go to the washroom early morning, WhatsApp, Facebook, email, Instagram, all the social media activities will happen in WhatsApp in the first episode in the morning. Most of the patients who come to me, 8 out of 10 patients say they use mobile in the washrooms. When they use mobile in the washrooms because of gravity, sitting too much of time, because of pressure, people develop hemorrhoids. Second thing is the primary idiopathic constipation, where people does not pass stools for 3 days or more. People spend too much of time in the washroom on straining. So while straining for more than 50% of the time in the washroom, passing type A and type 2 stools in Bristol stool chart, very hard stools. So this is primary idiopathic constipation, which has to be treated. Third most important thing is the constipation in women, which is not identified properly, diagnosed properly. And this is the area where people need to give a lot of attention. In our hospital, many women come with piles. When many women come with piles, when you go deep into the history, we see women have delivered a normal child. Women have delivered a very big baby. Women have got a very prolonged labor. Or women have delivered in the hospitals in 60s, 70s, and 80s. These people, when they deliver, there is pressure in the pelvis. There is the pressure in the birth canal or the uterus. There is pressure in the bladder and rectum also. So when there is pressure on the rectum will come down. It is called as rectocele. So when there is rectocele, when a woman passes stools, she feels something is stuck inside. Something is blocking her stool inside. So that time, many women, they put their finger to evacuate the ball. Some people will push the gluteal region to evacuate the ball. Some people go from doctor to doctor telling that they have constipation. Doctor prescribe laxatives. Doctor prescribe some bulk laxatives. And I have seen women suffering for 45, 30, 20, 10, 5 years. So this is surgical constipation, which has to be addressed. So you ask me, what are the main causes? Constipation is mother of all disease. In the recent times, this anorectal problems are increasing in incidence because of the lifestyle, the eating habits, the junk food, the online food, lack of sleep, spending too much of screen time, IT professional, sitting in a place for a long time, drivers, tailors. So all these people who sit in a place for a long time and with the lifestyle which I mentioned are more prone for anorectal problems.
So, doctor, according to you, for all these hemorrhoids, fissures, and fistulas, what kind of treatment options are available? If you can please elaborate on both non-surgical and surgical approaches through which the patients can effectively manage.
If I need to talk very elaborately, I need each topic one session. I'll give a brief overview about treating hemorrhoids, fissures, and fistulas. Okay, Let me talk about fistula first. Many people have a myth that fistula cannot be treated. Fistula will reoccur. So why do I get operated? It is totally wrong. Okay, out of 100 fistulas, 90% of the fistulas are infective fistulas, can be treated very easily. Remaining 10% of the fistulas are due to tuberculosis, Crohn's disease, ulcerative colitis, chlamydial infections, and other causes. Any fistula can be treated completely 100%, provided if the operating surgeon is good, provided if they treat the root cause. Okay, fistula, the only line of treatment is surgery, right? So when we operate on a fistula, two things are very important to keep it in mind. One is the patient should not have a recurrence of fistula, which is very, very important. Number two is the patient should not lose control over the sphincters when we operate on a fistula. So in the recent times, we have sphincter saving procedures for fistula surgeries. We do laser procedure for fistulas. We do lift procedure for fistulas. We do waft procedure for fistulas. We do a DLPL procedure for fistulas. So these are the few of the procedures what we are practicing on a day-to-day basis to treat fistula surgeries. Fistula is one thing which is not standardized in the world. A cardiac surgery is standardized. A rectal surgery is a standardized procedure. A rectal cancer is a standardized procedure. If you go to a fistula clinic in Ethiopia, or if you go to Bible of Surgery, Goliger, it is mentioned that many surgeons' reputation is spoiled because of operating on a fistula surgery. He mentions that it is easier to operate a cancer than a fistula surgery. So I have chosen a path which is less traveled, a fistula surgery. I was prepared to, getting my reputation spoiled. I was prepared to choose a difficult path. So fistula is one surgery which is very, very difficult to operate. At least 30% of fistulas are very complex, which will not fall into any of the classifications of fistulas given in Bibles of surgery. Okay, so this is one. Second thing is hemorrhoids. Hemorrhoids, grade 1 doesn't require any surgery. Early grade 2 doesn't require any surgery. Late grade 2, that is hemorrhoidal mass coming out and going into the anal canal, may require surgery. Right? In grade 2, it will be very, minimally invasive surgeries like infrared coagulation, radiofrequency ablation. In grade 3, where the hemorrhoidal mass comes out, it doesn't go inside, patient has to push it inside, then we do a combination of DG Hall-RAR, Doppler guided hemorrhoidal artery ligation and laser hemorrhoidoplasty. This is what we do. For grade 4, again DG Hall-RAR. For external hemorrhoids, even today, the gold standard what we practice is laser Milligan-Morgan hemorrhoidectomy. This is for treatment of hemorrhoids. For fissures, When there is a very acute fissure, when there is a bad pain, some people will come and tell us that, get rid of this pain. I can't bear this. So that time we do a laser sphincterolysis. We don't do a laser sphincterotomy. We do a sphincterolysis where we don't cut open the sphincter muscles. Right. Ideally, an acute fissure can be treated with medications and lifestyle modification. If it is a chronic fissure, repeatedly on and off the patient is getting fissures, then we need to do a laser fissurectomy for that particular patient in fissures. Coming to perianal abscess. Perianal abscess is a journey towards the fistula. Again, abscess in the anal canal, abscess in the perianal region has to be drained. There is no second choice. So these are the myths, especially in anorectal surgery, where people think if I operate, I'll get back again. If I operate, I'll lose control over stones. If I operate, I will not be able to go for work for a long time. It is all false, nothing like that. It can be cured completely. Because of this reason, people postpone seeking doctor's help for a long time, especially because of shyness, because of stigma attached to it. When it comes to women, forget it. Average time women spend with this disease is 9 years. We have seen women spending for 40 long years, 50 long years, and then coming to us, I have this problem.
Yes, Doctor. Yeah, rightly said. Yeah, I do agree with you. Like how you mentioned, most of the women who have undergone deliveries in their early age, and they sometimes feel very shy in approaching the right doctors and the surgeons like you to undergo the treatment. I do agree with you, Doctor. So today's webinar is a message to all who are listening to us today. So doctor has very clearly mentioned that whenever you have these kind of issues, either it can be a hemorrhoid, fissure, fistula, please make sure that you take guidance of your expert doctor at the right time instead of prolonging it for a very longer duration. Now, the doctor mentions 9 years, minimum of 5 years. It's a very long period, and the complications keep increasing when you delay it. So early intervention is very much needed during these conditions. Thank you very much, doctor, for that. So ensuring that proper wound care and also dressing changes are also very important for good healing and to prevent infections after surgery. So doctor, can you please provide the essential steps to the patients which they need to follow in order to have a better post-surgery recovery phase?
Yeah, post-recovery phase, in order to prevent infections, very clearly, proper antibiotic coverage. People have to take antibiotics on time. Second thing is they have to keep the wound neat, clean, and dry, and follow the instructions whatever we have given. And a good sitz bath will increase the blood supply by relaxing the sphincter muscles, and by this way the wound healing is faster, the pain is lesser, the burning irritation is lesser. So these are the few things patients have to follow to prevent infections in the post-operative period in anorectal surgeries.
So, doctor, like you mentioned, sitz bath. Can you also please specify how many times a sitz bath is usually recommended among these surgical patients?
There is no hard and fast rule how many times you should take a sitz bath. At least minimum what we recommend is 2 times a day, very clearly, and after passing every ball, right? Sitz bath is nothing but, imagine we taking a regular bath. When we take a regular warm water bath, it is so soothing, right? We feel very relaxed. Yeah. It's like hydrotherapy. So when we take a bath for the entire body, it's for the whole body. You can call it a sitz bath for the whole body. When we take only to the perineal region, that region, because of the post-operative pain, post-operative wound healing, it needs to be clean. We need to prevent it from infection. The blood supply has to increase. The pain has to come down. Every time after they move the bowel, ideally sitz bath is recommended, right? If the pain is more, if the patient is suffering with more pain, then he can anytime take a sitz bath. Not a problem at all.
Okay. Okay, doctor. So when we consider the surgical treatments for rectal disorders, what are the distinct advantages and benefits associated with STAR procedure, that is staple trans anal rectal resection, in comparison to other available options?
See, STAR procedure is, as I was mentioning to you that we have anterior rectocele and posterior rectocele in case of prolonged labor, in case of obstructed labor, okay, in case of big babies. In these conditions, when there is a rectocele, there is something called as obstructive defecation syndrome. In obstructive defecation syndrome, we do STAR procedure for this particular syndrome. In this procedure, it is a minimally invasive transanal procedure. We go through the rectum and we excise the rectocele part. The patient can get back to work on next day morning. She will not even know that she has undergone surgery.
Okay. Okay, that's.
In fact, we do the highest number of STAR procedures in Karnataka state. I don't know about other parts of India. In Mumbai, many people do it, and in Karnataka, we do the highest number of STAR procedures month on month. Yeah, that's nice.
Great, doctor. Okay, so now for these post-surgical patients, resuming back to their physical activities, which you already mentioned is very, very important, and also exercising after the surgery is a crucial step in resuming the recovery process, like speeding up the process. So what are the recommended guidelines for gradually getting back to their normal physical activities and exercise in order to also ensure there is a safe and successful recovery?
Yeah. See, I always tell physical activity is the best painkiller. Physical activity is the best painkiller. Okay. So generally, what we recommend at Smiles is we will take the patient. We'll tell the patient to take one complete day bed rest. This is because of the anesthesia. The very next day, 90 out of 100 patients with Smiles, they go to gym, they do yoga, they do physical activity, they get back to their regular normal work. About 5% get back in 2-3 days time. About 2% will take at least 15 days because they're more sensitive to pain. So the earlier we mobilize the patient, the better is the recovery. The sooner the better.
And usually, what kind of physical activities would you suggest them, doctor?
Any physical activity the patient is following on a day-to-day routine, he can get back. Especially for anorectal procedures, we recommend proper pelvic floor exercises so that the blood supply is increased, the pain is reduced, healing is faster, the burning irritation is reduced. I have told you, when people get back to hardcore yoga activities, they hit the gym the very next day, they go for a marathon walking. So it all depends on the patient, and any routine physical activity the patient is doing, he can follow along with other specified activities like Kegels exercises, pelvic floor exercises, and all this stuff, what we recommend for anorectal procedures.
So sometimes some of the patients, because they feel like they have to get back to their normal routine, tend to exercise more. And how do they avoid all this overexertion? So they have to do it step by step, right, doctor? So what do you suggest to these patients?
No, there's nothing like once the anesthesia effect is gone. After 48 hours, they can get back to complete regular normal activity. There's no overexertion in physical activity. See, for example, if somebody is walking 6 kilometers a day, next day morning he gets operated, the next day he takes complete breaks. The subsequent day, if he walks 6 kilometers, it is not overexertion. Okay. If you walk 16 kilometers, it is overexertion.
Yeah.
6 kilometers, which is something which is accustomed. Any patient who is accustomed to any particular physical activity can get back. A person who is not accustomed to any physical activity at all, we recommend pelvic floor exercises and Kegels exercises slowly you can get back to 1 kilometer, 30 minutes walking or 45 minutes walking. Slowly you can get back.
So can patient also start with the Kegel exercises within 48 hours of the surgery?
We recommend immediately, very next day, Kegel exercises.
Okay, okay. Okay, doctor. So during these kind of Kegel exercises, are there any additional precautions to be taken by these patients?
No additional precautions to be taken. Kegel exercises not only during post-operative care or during any elective procedures. They can do Kegel exercises lifelong. It's a very good exercise for men. It will prevent prostatic cancer in old age.
Okay. Okay, doctor. So now coming to the diet aspect. So balanced nutrition is very important at any given point of time. So during the post-operative period, what specific dietary recommendations should patients follow to support the healing process very effectively?
Yeah. So healing process, you know very well, balanced nutrition is very, very important. Proper micronutrients are very, very important. But when it comes to elective surgeries, complete healing takes place about 6 weeks in the anal canal. Complete healing for any major procedure, for any minor procedure for about 2 weeks time. So along with balanced diet, we recommend to prevent certain foods which are hard in nature. People who consume non-vegetarian, when they eat non-veg, the stool becomes harder. When they pass a hard stool, it will be very painful. So we try to prevent non-veg for about 4 weeks time for people who are non-vegetarians. For vegetarians, they can get back to the regular, normal, routine, day-to-day diet, along with less spices in their diet. That's all. Spices, the reason being, when they eat spicy food, when they pass stools also, it'll be burning in the anal canal. That's all.
So that is why you always recommend a bland diet for first few days after the surgery.
To reduce the pain, to reduce the burning sensation.
Yeah. And most of the times, doctor, when our care coordinators are discussing with the patients, they usually ask the nurses, like our care coordinators, that when will you stop the bland diet? I want to get back to the normal diet. And because they feel like they have to start eating their normal spicy food. So what do you recommend to these patients?
See, not all patients are same, okay? For a simple minor procedure, we can't put the patient on a bland diet for a month or so. They can start immediately in a week's time, right? So it depends on patient to patient. It depends on patient to patient. But for a very, say for example, for a very big fistula surgery where it was a complicated fistula, it needed multiple openings. In such patients, you can take bland diet for a 4 weeks or so. But for simple hemorrhoid or simple fissures, patients can get back to regular normal diet in a week's time. Whatever they prepare at home, they can do that. But not a Swiggy or an online or a Zomato or a cloud kitchen or some restaurant and eat some junk and again spoil. Okay, don't make anything people can take, not a problem at all.
Yes.
Until they're from Andhra Pradesh, where they eat a lot of spicy food.
Yes, doctor. So yeah, now we have made it a regular process to provide these gastro surgery patients with the first week of bland diet, and then from second week till the fourth week, we are giving them the regular diet. So yeah, and also, doctor, in order to prevent constipation, you already very clearly mentioned that constipation is the mother of all these kind of issues related to gastro disorders. So in order to prevent this constipation and other digestive issues during the post-operative recovery phase, what are the steps that you recommend to these patients?
Yeah, very simple. Good water intake, at least 1 liter for every 20 kgs. Good fruits, good vegetables, good fiber, good physical activity, good sleep. And if the stool is hard, in spite of this, a good laxator, polyethyl glycol in the night, about 10, 15 or 20 ml, should prevent hard stools. Let us not use the word constipation, prevent hard stools.
Yeah.
Okay, yeah.
Okay. And also, you already mentioned very clearly, doctor, that proper wound care management is very crucial for successful healing and also for minimizing the complications. So can you also explain in detail the role of wound care counseling in the post-operative recovery process?
Role of wound care counseling. Say, for example, if people are from Bangalore, we operate in Bangalore and patients come for regular follow-up. We see them on the first week. We see them after 3 weeks of surgery. We see them after 1 month of, 2 months of surgery. We do generally 3 follow-ups. Why 3 follow-ups? We want to see the wound until it is completely healed. Clear? Imagine a patient is coming from West Bengal or Odisha or Jharkhand or Bangladesh. We get patients from 40 countries. So here, what we do is through QR platform, we take images of the pictures. We see the images. Then the QR coordinator sends us images. So we see the images and tell the status of the wound. If the wound is pink in color, it is healing very well. If there is yellowish in nature, that means there is some slough or pus in the wound. Okay, so wound care, many people confuse and tell doctor there's some discharge happening too. Actually, it is not a discharge. Whenever a wound heals, there is something called a serous fluid. Okay, in the layman language, we can tell it is healing fluid. Okay, then we apply topical applications, ointments there. Then there is anal canal secretions. All these things will look yellowish in color and they feel it is pus. Actually, it is not. They are given a detailed instructions to the patients on diet, on wound care, on sit spa, on physical activity, all these things with the support of QR coordinators. Okay, we have a dietitian, we have a physio, we have nurses, we have doctors, we have the consultants. So all in the platform, there will be, a multidisciplinary approach to post-operative care is there in our QR platform, which are where we are getting great clinical outcomes and a great patient experience.
Yeah, rightly said, doctor. Thank you so much for that. And the regular monitoring of these patients after surgery is a very important aspect of post-operative care. So like you already mentioned, this is benefiting the patients and they are recovering very quickly. And most of the patients have provided positive feedback and appreciated the doctors and the hospital staff along with the care coordinators and the care team experts as well. So I want to also ask about how does this digital healthcare apps like our Qurbook app and the AI technology benefit the recovery phase among surgery patients, and how does it ease doctors' regular therapy process?
Yeah, as I mentioned earlier, we can't take every call. We become telephone operators when we take every call. Okay, now people are talking only about digital health. Whatever amount of digital health come into this world, you cannot replace a doctor. A digital health cannot replace a doctor.
Yes.
Right? The robot also cannot replace a doctor. Robot is in between the patient and the doctor. Okay, so digital health is also in between the patient and the doctor. Right? So in spite of this, now it is era of digital health, telehealth, telemedicine. Okay, I have seen people diagnosing a rectal cancer as piles and treating on digital health. I have seen a colorectal cancer as piles and treating on digital health. So digital health cannot be replaced by a doctor. But a platform like QurHealth, where the patient is already operated and he goes to home for his post-operative care, definitely there will be a great role to play in post-operative care and wound healing. How it will play a role is, see, today we have our coordinators, healthcare coordinators in QurHealth. Tomorrow we have huge data with QurHealth. You work with SMICE and I give about few thousand data to you. And this data, you will develop algorithms. You will replace all these coordinators of playing, this nurses replaced, this physio guys replaced. They will lose employment very clearly. Umakant is out. Jamuna is also out one day.
No.
Thank you. Okay, AI. So see now they say either we digitize or we die. Digitization is very important anywhere in India, especially. It's a big subject. When it comes specifically to post-operative care, definitely through a platform, through an app, the patient is able to access the coordinator at this moment and take services. Tomorrow, these coordinators will be replaced by AI. That's all.
No, doctor. Actually, what you said is partially true. Okay, so it's not we will not be able to replace everybody. Like how you very rightly mentioned that doctors can never be replaced. Likewise, even the care, even the
OT technicians can be replaced. Okay, OT nurses can be replaced.
No. So whenever the care coordinator, the nurse speak to the patients, that conversation becomes very important, doctor. So whatever we have AI can be a supportive system, but AI cannot replace you.
That is all. That is all. In healthcare, very clear that when you talk physically to a doctor or a nurse or a care coordinator or a supporting staff, that level of comfort zone for the patient is not there when they talk to an AI or a robot.
Yeah, that is always there, doctor. So thank you very much. It was a very special session with you, doctor, today. I'm really very happy because though you are a great surgeon, and along with that you are a professor, and you have been teaching medical students. But today's session, you were teaching all of us and providing the knowledge, like how you provide to the kids at school. So I hope everybody would have understood very clearly. Even the layman would have understood very clearly today. So now I would request Dr. Isha, our marketing and communications leader, to conduct the Q&A session.
Thanks, Dr. Jamuna. And yes, Dr. Parameshwar, what Dr. Jamuna said, it's right. The way you have been explaining, it's really commendable. And this kind of combination I have seen very rare. Doctors are very good in what they do, but when it comes to making understand, and the way you have, been accepting about the digital part and the innovation part is something I would really, I appreciate in you, and it's commendable. So thanks a lot for that. And
thank you, Dr. Isha. Thank you very much.
Yeah, and thanks for being part of this webinar. And I do have some questions that our audience has asked, and I believe it's a good thing because they have been curious after the way you have been explaining.
Yeah.
The very first question that one of the audience has raised is, being diabetic, they fear getting such procedures done, even for a hemorrhoid. So is it safe for them to undergo such procedures when they are diabetic?
Yeah, see, there are two things for a diabetic patient. One is the anesthesia part, one is the surgery part. Okay, the anesthesia part, even with the risk, what we do for such procedure is saddle blocks. It's not general anesthesia, it's not total spinal anesthesia. Only the particular part is given regional anesthesia. So safely it is taken care of. Second thing is uncontrolled diabetes. Imagine a patient comes with perineal abscess. Until and unless you drain the diabetes will not come under control. Okay, so what we do here is all minimally invasive procedures. All the elective procedures, we control diabetes under. But emergency procedures, if the patient is on diabetic tablets, anti-diabetic tablets, we switch out to insulin for a day or two, control diabetes, and then discharge the patient. So there is no risk with diabetes to do such procedures.
So thanks for that. And I believe many of the diabetic patients do have this restraint in their mind, should they or should they not go for surgery. So thanks for that. One more question that the audience has raised is regarding the elderly patients. Elderly patients, when it comes to gastric issues, they do feel it's something normal that happens with age, and they keep on lingering with the complaint, and they don't undergo the procedure, or they fear the procedure. So is there any takeaway for them? If you can explain Is it complicated or is it good to go for it?
Yeah. See,
Quality
Dr.
of life.
Dr. Isha, what happens is, as the age progresses, the incidence of piles increases because of the elasticity of the tissues comes down, and the piles will become grade 1 to grade 2, grade 2 to grade 3. When it is grade 3, then there is a worry for the elderly patients. When the mass comes out, it doesn't go inside, they push in the hand. Then they start worrying. When it becomes grade 4 prolapse, it doesn't go inside at all. Then it becomes an emergency and patients come to us. We have seen a 98-year-old man last week coming to us with piles, and he's been telling his children that I'm suffering from piles, and nobody is bothered because they can't see it right.
Correct.
When we examine him on those grade 4 collapse, it had a very bad fissure which is not healing. 98-year-old man. That man says, I will come soon if you don't get me operated. Then we operated. That man is doing well. I think he is registered with QurHealth and he is doing a great, very well. Okay. So like this 90 plus patients, we have treated many elderly patients without any risk. We have operated 5 surgeries on 90 plus patients, at least more than 60 to 70 number till date in the last 5 years in this center alone.
Okay. So thanks. Yeah, I do believe elder care, when it comes to elderly, there is a restraint in the mind too, should they go for it. And as you just mentioned, it do requires the right kind of care and to get the things resolved.
Yeah, I tell you, see, not all surgeries in elderly care we operate in elderly patients. People tell 70 ho gaya, why risk in this age? 80 ho gaya, why risk in this age? Imagine something is bothering you in day-to-day life.
Yeah.
Like it has come out. You're not able to sit. You're not able to fast food. You're not able to eat food. What a person has to do, right? There should be quality of life, right?
Agreed.
So that is the reason why elderly patient pile surgery can be done comfortably without any complication, zero complications.
So the takeaway for this is, that we can get them without any complication and improve the quality of life for the patient.
Yeah.
Agreed. So, and one question that I have from my end before I take the last question, Dr. Parameshwar, we have seen, we have set off examinations as a precaution or as an annual thing for all kind of, troubles. We have for cardiac, we have for, other things as well. Is there anything that you ask your patients that should be periodically done that they can avoid such issues that are related to gastrointestinal system and different ages, as you just mentioned, the corporates who are sitting long and getting all the stuff? Is there anything specific that we can add on to our annual checkups that can help us?
Dr. Isha, you in the bullseye. What are you specialized in?
But I am a homeopathic doctor. I have done my specialization into trichology, but I have been into medical communication for quite some time.
You know something? You communicated the right thing. My sincere acknowledgement to you. So far, none of my colleagues have raised this question to me. I'll spend some time on this. It's worth to. Okay?
Yeah.
In India, is the only nation we don't have any GI awareness program.
Correct.
We don't have colorectal awareness program in the country. 36% of India's population are suffering from some kind of colorectal issue, piles, fissure, fistula, constipation, rectal cancers, colorectal cancers. The only cancer which is diagnosed late in this country is colorectal cancer. 78% of colorectal cancers are diagnosed late when they are not operable. How much? 78%. That means 80% of the colorectal patients die without even getting diagnosed. Got it?
Yeah.
This is one. Next thing is, we have quacks in this country. We have 1.5 million quacks. With due respect to all religions, Muslims, they practice this colorectal. You must have seen big boards, big hoardings telling them, "Aadha din mein kaam ho jayega, aadha ghanta mein kaam ho jayega." Okay. And you have Bengali doctors across the nation. So these people, they are spoiling lives of many millions in this country. People are dying. Colon cancer not diagnosed. Many people have committed suicides. Got it? So there is no screening for colorectal cancer in this country. But in the US, there is screening for colorectal cancer.
Yeah.
Because the incidence of colorectal cancer is very high in the country. Even though it is less in India, it is said that as per American College of Colon and Rectal Surgeons, there is an increase of colorectal cancers in 30 years age group by 30% by 2030. 30 age group, 30% by 2030. In India, after 30 years, you see this.
Yeah.
Instead of seeing after 30 years, it's been prevented. So there is no screening program in this country so far for any GI related disorders like other programs like oral cancers,
Yes.
breast cancer, cervical cancers, and all such national programs.
Yeah.
Right? So I met the Niti Aayog Vice Chairman to include in this one of the national programs sometimes back, but it did not take place. We need to take it forward and make it a national program. This is number one. Number two is special message to all young girls. Young girls, before getting married, they should ensure that they don't have a pies, they don't have a skin tag around the anus, and if at all they have anything, they need to consult their specialist, get it fixed, and then get married. Number two, young mothers who wants to conceive, ensure that they don't have piles before conceiving, because
It'll aggravate.
when they conceive, because of progesterone, because of iron preparation, because of the fetus in the uterus, the piles will, or fissure, or whatever any irritation will exacerbate, they will end up problems. Neither they can terminate nor they can live with disease. Every day we see many mothers crying here.
Yeah.
So this is one prevention for young ladies. Other thing is debate. Probably we all of us can take, me, you, Jamuna, Ravi, Kundu, all of us can take and start awareness program in this country and make a huge transformation.
Certainly, I think so that is really required, and thanks for that. I do believe that awareness is really less when it comes to this particular section, and people do take it for granted. And thanks for that. And I think so, hopefully, as you have already started the efforts, we'll be seeing these programs as nationally along all across country. So thanks for that, Dr. Parameshwar, for being available and giving us such an insight into all this. Thank you for that. Dr. Jamuna, over to you.
Yeah, thanks, Dr. Isha.
Yeah.
Yeah, thanks, Dr. Isha, for coordinating. So thank you very much, Dr. Parameshwar, for providing us with the comprehensive insights into post-operative complications and its impact on treatment outcomes. I'm sure that today's audience have gained a valuable knowledge about post-operative care, empowering them to follow the instructions and the advice given by their surgeons and to prevent complications and promote successful recovery. And at Smiles, Dr. Parameshwar, you have been doing a great job, and you have been making the lives of most of the patients painless from painful. And as you already mentioned that these kind of issues, gastro-related issues, that is this fistula, fissures, hemorrhoids, piles, all these are really very, very painful. And sometimes most of them bear this pain for years, like you mentioned, more than 10 years, 20 years, or sometimes even 40 years. So you have relieved this major kind of burden regarding the pain among all these patients. So thanks to you, doctor. And also we have been able to work along with you in association with Smiles. QurHealth has been able to provide the post-operative care to all your patients. And thanks for all your support. And we will continue doing it in coming days as well. And our main aim is to make sure that the patients are recovering and there is no secondary complications or readmissions happening after any kind of surgeries. So thank you very much, Dr. Parameshwar. And dear viewers, to avail the benefits of our care plans and diet plans, along with the care coordination services, please download QurBook app from Play Store. You can download it for free. You have to just type QURBOOK. We have introduced post-surgical care plans and diet plans in the app, especially for patients who have undergone different kinds of surgeries. We will be very happy to serve you and your healthcare needs. Kindly contact us for subscriptions and any kind of queries. Thank you all for joining us today. Take care. Bye.
Jamuna, dot 6 o'clock. What time management?
Thank you, doctor. Thank you so much.
QurHealth will be a game changer in post-operative care in this country. I'm sure you will be transforming lives of millions of people who undergo surgery. Okay. I wish you all the best in this endeavor. Keep up the work. Great work. Thank you very much.
Thank you very much, doctor. Thank you. Thank you all. Thank you, audience.